Years ago, I heard about Botox. Botox is a toxin, botulism toxin, that you can inject into the face muscles, and it makes the muscles in the face paralyzed for a few months. This releases the wrinkles in the skin. Wrinkles in the skin of the face are caused by muscles under the skin being tight, being basically in spasm, contracting without the ability to relax. And this happens from excessive gesturing in the face, or any of the muscles in the body that you use too much. If they fatigue, they will get tight and they won't let go, including the muscles in the face. So the expressions that we make in the face actually do stick if we make a strong expression for a long period of time or overuse the face muscles. So wrinkles occur. They occur because there are tight muscles, and if you can release those muscles, the wrinkles will pop out. They'll smooth out, and Botox is a way of doing that. And I thought when I first heard of Botox that maybe pressure point release could do the same thing. Turns out it actually has been a practice in many cultures for a long time as far as beauty practices. The technique that I've developed is from observations I've had of clients of mine where I actually have worked on their face, and I noticed that the wrinkles smoothed out. Once I got the idea of Botox, I realized, well, I really need to target each muscle. So I've gone through each muscle over many years and figured out the effective mechanics for releasing those muscles. And honestly, the results have been astonishing. I perform these techniques over and over. There's about 16 basic muscles on each side of the face that you have to release. And when all of them are released, it's visually mind-blowing. So I'm going to go ahead and show you these techniques. I hope that you learn all of them, and you'll be really amazed, and anybody that you practice this technique on will be really thoroughly astonished by how great they look after. So I really recommend doing a before and after picture. This is a releaseology course, so the way to go about this course is pretty simple. There are a few steps that you have to take with each muscle. The overall idea is that you're going to use pressure point release with the face muscles. So first, you have to have a really good stance. So you're going to be seated on a stool, and you have to have the weight of your body controlled by your legs. So you have to have your feet under you and not slouching, and control your body and use your core muscles, so your torso and your upper body are controlled very well, because you're going to be using your arms and using your fingers on face muscles, which are delicate, and you have to have very good control so you don't slip, and so you can target the specific fibers of the facial muscles. They're harder to palpate than other muscles because they're very small. They feel like shoestrings. And if you pay attention and follow my palpation demonstrations, you'll be able to find each muscle. It's very important that you do really feel each muscle though. And you're going to pin down the muscles of the face. You're going to basically hold them down, stretch them with one finger, while you go ahead and try to do a pressure point release with that finger. And on the other hand, you're going to try to find the same muscles closer to the origin and hold the muscle down there. And with both fingers, you're going to try to stretch the facial muscle and conduct a yang-yin pulse, which is going to release the muscle, and you have to really do it until you feel like the muscle releases. And there's a very distinct release. It feels like when you're stretching a rubber band, and then all of a sudden the rubber band just melts and stops feeling tight and doesn't have any recoil. So this is what we're going to do with each facial muscle, and there are a couple other steps. I want you to draw the muscles. So as you go through the video, you're going to do a lot of pausing and rewinding. I want you to go through each muscle, look at the muscle on the illustrations provided on this course that go along with this video. And for the face muscles, I actually have an overlay so you can get an idea of what the muscle looks like over the face on the video. So for each muscle, go ahead and watch one muscle at a time, and stop it, pause it after you've watched it, and then go ahead and find the PDF worksheet that goes along with this. So it's going to be a skeletal picture of the front of the face, and it has fill-in blanks for origin, insertion, nerve supply, and movement of that muscle. And go ahead and find that, load it onto your phone. Use your drawing tool on your phone. You can maybe save it to your photos and reopen it and draw on it, and draw where you think the muscle goes on the picture of the bones. Go ahead and fill in the origin, insertion, movement, and nerve supply. Just go ahead and write it in,
and that data is provided also on the muscle pictures that go along with this course. So go ahead and look at the facial muscles, find that data, do the fill-ins, and try to do the drawings from memory. You really have to look at the picture and then put it away, and then on the worksheet, go ahead and use your phone to try to draw where you think the muscle goes. Try it a few times until you think you get it right, and then send that photo to me, to my email. All that data is provided on where to send the email, and go ahead and do your best shot. If any of it's incorrect, I'll just let you know what the mistakes were. So if you want, you can redraw the muscles to get it right. It's really important to know where the muscles are before you go ahead and try to find them with your fingers. So that said, that's the exercise for muscle memorization. Go ahead and do this before you begin each muscle of the face. It takes a while to do this, but it'll really be worth the time, and you'll never forget the muscles, and you'll have a great grasp on how to release the muscles of the face for Notox. So after you've done the drawings and taken a photo and emailed it to me for each muscle, go ahead and try the technique that you see on the video. Again, this is a lot of pausing and rewinding. And videotape yourself doing the technique. So just have something set up. You don't have to do a long extended performance of each technique. Just basically show me 3 things. Generally how your stance is, I want to see in your video. And with your hands, I want to see how your fingers are positioned, and I want to clearly see a yang-yin release. I want to feel the muscle release from the video that you take. So do each one until each of the muscles of the face, try the release technique, and go ahead and videotape yourself when you feel like you have the muscle release technique correctly performed. And there are slightly different ways of doing it, but just make sure you get the muscle to release and use good mechanics, and don't hurt your hands. Hand position is everything, and yang-yin pulse is even more important for this. After you've done all the releases, go ahead and take the final step where you get a testimonial from the person that you practiced on, and I want you to show a before and after picture of their face. And let's get a video testimonial of how they feel about how they look after you're done with the treatment, and we'll go ahead and upload those videos to me at the designated email that we're using, and we'll look forward to seeing your results. It'll be great. Your person that you're practicing on will really be amazed. And let's go ahead and go through the class, because it is a way of releasing facial wrinkles without toxins. First, we're going to show you the corrugator supercillii muscle. This is a muscle that causes the 11s, the famous 11 wrinkles that we get between the eyebrows. If you release this muscle, it releases the 11. So you pin down the origin side and you stretch the eyebrow away from that. And you're increasing your pressure. There's a nerve that comes out of the orbital, or out of the orbit of the eye. It's a branch of like the facial nerves, and it goes under the eyebrow there. And so it can cause kind of a stinging pain if you're right on it. So you have to be kind of careful, but you almost kind of want to get that sensation a little bit, because it always seems to happen when you get a good release. But you don't want to make it too strong, too intense. So anyway, you can do yang, doing the stretch. Try to get that release with a slow pull over like maybe a minute, where you're slowly backing your pressure out and making it feel like you're backing out even though you hold your pressure steady. And feel it kind of melt under your finger. So, man, looks like it's releasing in this one. You can tell it's stinging with the way she was blinking there. Okay, now it looks like it's relaxing. Yep. So anyway, right after this, her 11s are going down. I can see it already. Not that she really had much, but you can just kind of see her eyebrow moved a lot smoother. Now let's do the orbicularis oculi muscle. The orbicularis oculi goes around the eyeball, around the orbit. As you can see in the picture, see the nerve I was telling you about that comes out of the orbit and travels up into the forehead, and also has a branch that travels down over the sinuses, over the cheek. And that muscle causes the crow's feet on the angles of the eye. So it's a big muscle, it's a ring. So let's stretch the upper part of the ring right under the corrugator. We did that first. I actually just kind of quickly did that. When you're stretching it, you do yang, hold the pressure, slowly let your pressure out. After you hold it for maybe a minute, You're making it feel like you are slowly backing out, even though you're holding your pressure pretty steady. And try to get the muscle to melt. You'll feel it because when you're stretching it, at first it feels really tight, and then the muscle, even though you're stretching it the same amount, it starts to relax if you do that yang-yin pulse the right way. So let's try it again on the lower part of the orbicularis oculi muscle. Got a little blurry there, sorry. Oh, okay, so you have to be careful right under the very middle of the eye because there's a vein, so I'm kind of avoiding it. You can see I'm like kind of to the inside or the outside, but not directly under. On the hard surface of the, right under the orbit of the eye, there's a little vein there. You don't want to press into that because it can cause bruising, so just stay away from that exact middle area where there's kind of a hard bony surface. But you can see I'm still stretching the muscle along the, the whole thing along the bottom. And I'm doing yang into the pressure points that my fingers are pressing in, and yin to do the releases. Remember that this muscle, the orbicularis oculi, is the muscle to release crow's feet on the inside and the outside angles of the eye. The other muscle to release on the inside of the eye, to release the crow's feet, is the nasalis muscle. And then another muscle I'll show you after that called the levator labii alequi nasi superioris oris. But first let's look at the nasalis. The nasalis flattens out the bridge of the nose and opens up the nostrils. You might have seen the things that facilitate breathing that look about the same. So it pushes the septum of the nose, or the cartilage down, not the septum, but the cartilage down into the face. So what you're doing is you're kind of lifting it off the face and stretching the muscle in that direction, like away from the face, and pressing in at the same time. So you do yang yin. Okay, now let's see the levator labii alequi nasi. I won't say the whole name because it's really long, but it comes down to the along the inner angle, or the joint between the nose and the cheek, between the lacrimal bone and the lips, and it attaches to the top of the lips. So like if someone was to sneer or lift the inside of their lips up, this is the muscle that does it. It's also in Chinese medicine at the bottom associated with the large intestine channel. So sometimes there's a connection there. And to release it, you just want to depress the muscle, stretching it down towards the lip, the way I'm doing, and you're kind of releasing pressure points with both fingers at the same time. Let's show you the lower section of this technique here. What I'm going to do is just do the other side and catch just the lower part of the levator labii alequi nasi's tendon just before it attaches to the lip, where it wraps around the nostril. And trying to get a hold of it, it's slippery. But what you want to do is press through the skin and try to press deep enough so you're going through the muscle and you're bringing the muscle with you and sliding it across the cheek. So you have to get the pressure just right, because you don't want to push so hard that you're pushing into the bone. You just want to slide the muscle across the bone, depressing down towards the lip. And if you get a good release here, it's really cool. It opens up the nose and the sinuses. This is really a great release technique for sinuses, and also you can imagine at a 90-degree angle all the little creases and wrinkles that would form when this muscle's in spasm. And it also distorts the upper lip. So if you want a nice full upper lip and no creases along that line, 90 degrees to that line, that's the muscle to release. So next, let's do a muscle that attaches to the top of the lip. It's called the levator labii superioris. And what it does is it lifts the lips. So to stretch it, of course, you have to, stretch the muscle down towards the mouth, towards the lips. And that stretches it. So you're stretching it with I'm stretching it with my lower thumb, with my left thumb. Not my lower thumb, left thumb, and my right finger is, you have to be careful, for that area, because there's veins right in there on that bony surface, so you really have to be careful to not press on the veins. I wish I wouldn't have shown that way. But what you want to do is, stretch the muscle down towards the lips and hold the pressure, slowly release, like yin-yin release. So you hold the pressure, make it more and more intense until you feel like you're really nailing the point, and slowly back your pressure out, making it feel like you're backing your pressure out, although you hold your pressure for a long period of time. And let me get my fingers set here. This is actually another muscle that's right next to the levator labii superioris. This actually doesn't go to the kind of the middle left of the lip, top of the lip. It goes to the angle. So it's called levator anguli superioris, and it lifts the angle of the lip, like when you smile. I think also when you sneer, or when I frown maybe, but also when you smile, basically. So I'm stretching it down, holding it with the tip of my finger, my left finger, and I'm feeling the stretch, yang mode, kind of intensifying pressure, and then I'm going to try to slow. Making it feel like I'm backing out, even though I'm really holding my pressure firm for probably a good, this is like maybe 45 seconds, a minute or so. Here's the zygomaticus minor. It's the one on the inside. This muscle lifts the lip in the direction that the muscle runs, the fibers run, and you want to stretch it, down towards the lip. These muscles are kind of like numbers, or the arms on a clock going around the mouth. So this is probably about 1:30, 1 o'clock, and the zygomaticus major is like 2 o'clock. So to feel around in the facial muscles, sometimes you have to do little tiny mini circles. Kind of circling over the muscle fibers, and when you shouldn't really be able to feel distinct muscle fibers when the facial muscles are relaxed. And if you can really feel fibers, then okay, so this is the zygomaticus major. The last one is the zygomaticus minor. But if you feel muscle fibers, they're in spasm. You shouldn't be able to feel them at all. They should normally feel like water. And if you do feel them, then they're probably enough to cause some creases. And even people that don't have creases can have a little bit of tension, a little bit of spasm in the facial muscle. So whatever fibers you feel, just stretch the muscles out towards the mouth. Hold the points, until you feel like you can trigger a release, and then slowly back your pressure out and wait for it to release. And sometimes I feel like the energy of the release is going through your finger, through your body, into the ground. All right, let's show you another angle. This is on the other side, zygomaticus minor. Sometimes the trick is just like, everyone's face is different, so there's no exact way to do this. You just have to basically, with 2 fingers, thumb or finger, pin the insertion side of the muscle down enough to stretch it, and go in with the other finger and try to do a pressure point release. So all the facial muscles are pretty much the same. It's amazing how this works too. These zygomaticus major and minor muscles, they really release that crease that forms between the cheek and the lip, and that's a crease that gets deeper and deeper with age. So you can really change someone's appearance by releasing the zygomaticus major and zygomaticus minor, as shown in this little video here. The first rule of releasology really is to do no harm, by the way. And cross-fiber palpation is our special way of feeling muscle. Okay, coming up are 2 of my favorite muscles, the buccinator and the risorius. The buccinator is a muscle that comes from the ramus of the mandible bone. So what that means is where the jawbone drops down before it comes out to the chin, it comes from there. And you can see in this picture here, and it comes out to the lips. So it pulls the lips back, as if we're smiling just along a horizontal line without lifting the lips. So it pulls the lips back, pulls the angles of the lips back, and opens the mouth in that direction. So what you have to do is you have to stretch it by, first you have to kind of feel where the fibers, the middle of the muscle is, and you can usually feel tight fibers if it's tight, and stretch the muscle towards the angle of the lips, and that kind of closes the lips. You should purse the lips if you stretch it all the way. Looks like I'm hooking in there. I got my pressure slowly building. I feel like the muscle's really stretching this, and it's starting to feel like it could release. Okay, there we go. It's starting to relax. I feel the muscle melting, and I'm making it feel like I'm backing out even though I don't go anywhere for probably a good 20 seconds there at the end of that. Let's show it from another angle. And this looks like I'm more into the risorius muscle, which is this muscle there. That muscle, that gland it was showing as the parotid gland. That's your main salivary gland. And this muscle, when it squeezes on a reflex, it squeezes the parotid gland and it makes you gleek. It's better known as a gleek, but it's when saliva squirts out of the glands under the tongue, and that's the muscle that squeezes it on an involuntary reflex when we think of something that's sour or whatever, or taste something that's sour. So you release it basically in the same way as the buccinator, but it sits on top of the buccinator, so it feels like a shoestring sitting on top of it. But the mechanics are the same. You're stretching towards the angle of the lip, stretching the muscle from the cheek towards the angle. See how I'm doing there? So I'm in the risorius specifically there, but I'm also on the buccinator, because the buccinator is beneath the risorius, so that could be confusing. But there's a lot of times people have that reflex kind of going and have like a discomfort in the cheek on a regular basis, and the risorius is the muscle that needs to be released for that. I've heard that complaint a few times. Slowly increasing your pressure until you can trigger the release, and then when you feel like it can go and it'll melt, then you start backing your pressure out very slowly. How to release the actual orbicularis oris muscle. So this is another orbicularis muscle. This is the one that goes around the mouth, which you can tell by the name oris, and we're going to show you the orbicularis oris on another model, because I actually have a little bit better footage on this one. So this one I did a few years ago with my friend Lisa. So what you do is you have to take it in different parts, because the orbicularis oris has an upper lip and a lower lip, and then it has the section of the upper lip under the nose, which is a little unique. So what I'm doing here is I'm stretching, basically away from that upper middle of the lip under the nose out towards the angles, just stretching it straight across. It would probably look really funny if you're looking at somebody, so don't laugh while you're doing this. But you'll feel the fibers reach the end of their range, the end of the rope basically, and you want to hold it and do yang pressure into those points while I had stretched, and then do the yin pulse to try to get it to release. Try to trigger release by slowly backing your pressure out. And I know I'm jumping ahead here with my demonstration, but okay, let's do the same idea but on the lower part of the orbicularis oris. This is I'm stretching the angle out, but from the middle of the lower lip now. So I'm pinning it down with my thumb and my index finger of my left hand, and using my index finger of my right hand to stretch the lip away. Let's look at it from an overhead view. Okay, so see, slide across, you feel the fibers coming to the end of how far they want to stretch. It's the facial muscles, it's always kind of slippery to just like pin them down, but you have to try different angles. That's what I'm doing here. So I'm actually just doing just the lower right now and trying to stretch it out. Taking it to the end of its stretch and holding the point, slowly increasing my pressure and going kind of deeper and deeper. And then my finger turned white there, so, and then it's doing it again. And I'll slowly back my pressure out and trigger the release. And that gets the lower part of the lip too while I let go. What it does is it actually makes the lips puff up. So people do a lot of medical augmentation for the lips, but most people don't know. You can just release the orbicularis oris muscle, and every section that you release, you'll see it actually puff up. You can probably see this happening, by the end of this treatment. So you see my finger turning white. I'm doing some yang pressure, just focusing energy in, just holding the stretch at the very end of how far it wants to stretch, and then slowly backing my pressure out, holding the same pressure basically, but making it feel like I'm slowly backing out. That's the trick always with any muscle. So you see me kind of slipping into yin mode, and I'm feeling the lower part of the lip on the right now, finally starting to relax. So let's do the left side of the lower orbicularis oris. See my fingers turning white on the left now, so that means I'm stretching it out to the end of how far it wants to stretch, and I'm just pinning the muscle down and waiting. It feels like it wants to melt, so I'm going to start backing my pressure out now. This is yin mode, and slowly backing it out. You know, it's pretty quick, maybe 15-20 seconds or something like that. So let's show the whole technique from the side. And so you want to try this on both sides. You know, be really careful to make sure you're sliding the muscle, these facial muscles, across the bone, but not pushing into the facial bones. Definitely don't press hard enough to cause bruises. And you know, you have to practice a little bit. I'd say start out on the side of caution. So let's go to depressor anguli oris muscle now. The depressor anguli oris muscle pulls the angle of the lips down towards the chin. And it's an important muscle to release, especially for Notox, because it causes, you know, wrinkles that run kind of parallel with the lips and cross the line of the muscle that we're working on. So to release it, you got to stretch it up from the chin. It always has kind of it pulls into almost like a fat racer texture kind of area, just like attached right to the edge of the chin as you feel it around the crest of the chin. And the muscle comes up to the angle of the lip. So you want to stretch it up towards that angle with one finger, and with the other finger you just press in, hold the point, try to increase the pressure slowly with time over like maybe a minute, and then slowly back your pressure out, making it feel like you're still holding with like you're backing out, but you know, still maintaining a lot of pressure through the whole thing. So once you release it, then make sure you do both sides. It's important to do both sides on all the facial muscles. If you do one of the muscles on one side and anywhere in the face and don't do the paired muscle on the other side, it's definitely going to look strange. So just remember that when you're stretching a muscle and increasing your pressure into the pressure point, that's called yang mode, and when you're slowly backing your pressure out, that is called yin mode. And yin mode is when a muscle definitely releases, but if you don't get a nice focused yang mode to kickstart the yin mode, then the release doesn't happen with a lot of gusto. So it's sort of almost like pushing somebody on a swing. You know, you push them and then they come back, right? So you gotta stretch the muscle all the way to the very end of its stretch with one finger, hold the point, you know, really kind of challenging the muscle to stretch. And when you back your pressure out in what I call yin mode, you have to wait until you feel like it's going to start releasing. When you feel it start to release, then like you feel like it might release, then you can trigger it. The way to trigger it is you make it feel like you're suddenly starting to back out, but you actually really don't go anywhere, and you really just hold your pressure. So that's a little bit better explanation, hopefully, of yang mode and yin mode. But that's really the premise for all the techniques in releaseology throughout the body. It's especially important to get the techniques down for the face because these muscles are so short and small that the techniques have to, you know, with the yang and yin and everything else, have to be very precise. Also, make sure that you're not slouching or, you know, bringing your head closer to the person's head that you're working on. If you're practicing this technique, you don't need to be any closer with your head. You want to sit in a normal balanced position where your torso is upright and your head's up, and you know, you're feeling with your hands, so you're not looking right. You don't need to get your head closer. It's just a mistake I notice a lot of people make with this. Yin mode is when the muscle releases, so why rush? Take as long as you possibly can. Yin mode can take from 1 minute to 2 minutes, who knows, maybe 5 minutes. Take as long as you can, because the longer you can keep that yin mode, yin flow going, the more the muscle is going to release. That's really the part that gets the job done. Don't rush it. Only 2 more to go. Let's go ahead and look at the depressor labii inferioris muscle. So this muscle stretches the lip right in between the very middle of the lip and the angle. Pulls that part of the lip down towards the chin, kind of straight down, not towards the middle of the chin, but straight down. And when it's tight, which it usually is, it's tight really right around the attachment at the crest of the chin. So you want to stretch the muscle up with one finger, but really focus a lot of pressure with your other finger into the right where it attaches at the chin line. And you gotta really hold it, focus your energy in, really stretch it at the same time, challenging it to really stretch up and try to get the yin mode triggered and spend as much time as you can drawing that release out. I know they're small muscles, but they can really be stubborn, almost as stubborn as a really large muscle somehow. So let's go ahead and look at the different angle of the muscle here. How about upside down? So this is the depressor labii inferioris upside down, which is the position people are in a lot of times when you're working on them. So let's look at it here with Lisa. See, so I'm stretching the muscle up from the chin like I was explaining, and doing a strong pressure point really with both fingers. Remember, you're sliding the muscle over the bone and over the teeth if you get up over the teeth. Be careful to not push hard on someone's tooth, and be careful of dental work. The first rule, remember, on releaseology is to always do no harm, so that definitely really applies with dental work. Don't mess up someone's dental work or cause tooth pain. Be careful. But most of the pressure you're going to need to apply is really along the bulk of the muscle just before it attaches to the chin. You'll feel it. My lower thumb, the thumb that's further from me, from my head, is the one that's feeling the most density in the muscle. So you also want to be careful, you know, like all the other muscles or all the other techniques, you know, just be cognizant of your low back and your shoulders. Make sure your shoulders are down, and don't hold your head or neck in a funny position, and make sure your low back is in a neutral position where it's not too arched, and try to have your feet on the ground. It really helps with the yin mode. You'll notice that the yin flow, you know, when you're in yin mode and trying to release the muscle from those points, it just works a lot better when your feet are on the ground. I believe it's because electrons are flowing to the ground from the blocked muscles. I think muscles, when they're in spasm, basically have a buildup of electrons, and part of why releaseology works is because we're giving the electrons a path to ground. So let's just watch this a little bit more. I'll go ahead and let you just watch without explaining every detail. You can see my finger turn white and pink again. You can tell by that when I'm using pressure and letting go. So yeah, it looks like the yang and yin mode's working. I can see her lip is coming up a little bit easier than it was before. It looks like it might be releasing more on the right than the left. So, you know, always make sure you do both sides, okay? Gosh, let's think about this for a second. This is the very last muscle in the whole head, neck, and face course. So here it is, the last one. This is the mentalis. This is named after the thinking man, like the Greek statue of a guy, you know, with his fist on his chin, and he's thinking real hard. And in this case, Lisa is a deep thinker, very honestly, and that point gets tight because it purses the lip, it pulls the lip forward and down. It's a little bit different kind of muscle, but to release it, you want to stretch it up towards the lip, and I'm stabilizing her head with my other hand, by the way. So let me come over and press on the lower part of the mentalis muscle, and with the other finger I'm going to stretch the mentalis muscle up to the lip, stretching all the slack out of it, and a little yang and yin, slowly releasing the pressure, letting it, you know, off the hook from the stretch, and I'll get a little bit of release. And this really makes the lower lip right in the middle look a lot better. It's one of the most important points for Notox, and it also makes you feel very mentally clear for some reason. So Thank you for watching. I'm really glad to have you all the way through, and I'll catch you on. So for this course, it's really important that you do all the steps. First, make sure that you go through all the muscles in the entire course and do the memorization exercises. So go ahead and do the drawings either on your phone, or you can print out the PDFs and do them with a red pencil. Take a photo or screenshot of your phone and go ahead and send it to me, and I will review all the drawings and just let you know how you can make them better if there is a way. And if you do them perfectly, then I probably won't comment, or I'll let you know that you did them perfectly, or you might have a different instructor than me, but that'll be the goal from reviewing your drawings. And doing the drawings is a great way to memorize the muscles. You notice that I give you the muscle name. You're going to have to fill it out to when you save the files, use the name of the muscle as your file for the drawing, and that way you can actually practice writing out each muscle one at a time. But the drawings are the best way to memorize where the muscle is, so go ahead and make sure you do the drawings for each muscle before you try it. So look at the muscle on the illustration and go ahead and do the drawing, save it, send it to me or your instructor, and we will review those later. Then make sure that you go through each technique one at a time. Make sure you start and stop. Use the pause button a lot and rewind to go ahead and watch each technique one at a time until you can do and perform each technique with your own hands. Make sure that you pay close attention to your body mechanics, to your hand position, and make sure that you really feel a yang-yin pulse in the middle of the muscle that we're trying to get you to feel to release. Cross fiber palpation is always the way to find the muscle. Make sure that you do that before you start pressing into it, and you can use the information that you have from studying where the muscle is with the drawings to know exactly where it is. But it is kind of different when you use palpation. The three-dimensionality of the body makes it a little bit different than what you might think on the drawings, so that's why it's very important to do a good amount of palpation, as much time as it takes before you start pressing into the muscle, so you make sure that you're on the muscle and you really connect to the feeling of the muscle releasing at the end of it. So be sure to get a testimonial from your client at the very end, and your practice person, and get a before and after photo. It'll be really satisfying for both you, your client, and us to see how much progress you made in one treatment. It'll be amazing, and we look forward to seeing your results. And we look forward to having you in other courses here at Releaseology. Welcome to the family.